Hi, I'm Dr. Jeff McCombs. Thank you for joining us today. Today we're going to talk about antibiotics as a pathway to illness. This is something that I consistently have to study in looking at Candida and the digestive system, the intestinal tract, the immune system of the body, how the body responds to infectious agents. Antibiotics play such a big role because they have such a common place in our society and our culture today. And the way we tend to think about antibiotics tends to minimize the damage that they do and that they create. There's more and more science about this on a daily or weekly basis that does come out about the damaging effects of antibiotics. And it just seems to fit perfectly with the definition of antibiotics even. Antibiotic means against life. In some of the newer phrases that they're using to describe the study of disease and the study of health, antibiotics are classified under a category that's called negative biology, and supplements and probiotics and meditation and lifestyle changes are classified as positive biology. But if we go back to that definition of antibiotic, antibiotic means against life. So I thought I would look up life to see what life was, to see if I could get a clearer definition of what we're talking about. And the definition of life itself has many different interpretations, but one that I found that I really found to be really applicable to what we're talking about today was the description that life is a characteristic that distinguishes objects that have signaling and self-sustaining processes. So especially this component of self-sustaining processes. So if antibiotics are against life, then they're against self-sustaining processes. And that's exactly what happens with antibiotics in the body. We see a loss of the body's ability to self-sustain it. And with the use of antibiotics, we start to see all kinds of diseases and conditions that develop. Antibiotics have been implicated in life-threatening colitis, allergies, asthma, skin conditions, psoriasis, eczema. They've been implicated in cancers, obesity, diabetes, and especially with the obesity and diabetes, there's quite a bit of research that's coming forward on the role of antibiotics in creating these. So it's important to really grasp the effect of antibiotics when we take them, because they tend to be persistent, they tend to be long-term, they tend not to be very good at what we commonly assume that they're going to be good at, which is fighting infections. In fact, they sort of have the opposite effect. There's a lot of press, at least from the pharmaceutical and medical industry, and even some of the common press outlets around there that without antibiotics we would have a lot of problems, but I'm not so certain that that's as true as we're led to believe, because definitely with antibiotics we've created problems for ourselves as a society, as a culture. The World Health Organization now says that antibiotic resistance is one of the top 3 threats to human health on the planet, and some sources have said it's the #1 threat to human health on the planet. And this is specifically a result of antibiotic use. Antibiotics themselves are used extensively. They're used in animal husbandry. They're given to cattle, to chicken, to fatten them up, to make them more desirable for market conditions, to earn better return on the investment. But the effect of the antibiotic resistance that comes from that practice, as well as the effect of antibiotic resistance that is derived from direct use in humans, is without question something that's very devastating. If you look at methicillin-resistant staph, that is one of the big killers in the United States. It kills more people than AIDS and emphysema, Parkinson's, and homicide combined. So it's a big killer. And just last year, MRSA, as it's more commonly known, was surpassed by Clostridium difficile, which is another very common infectious agent, and especially the antibiotic-resistant form of it. So when we're looking at antibiotics, we're talking about things that have a very devastating effect on the body and they have a very long-term effect. When we look at cancers and obesity and diabetes, these are conditions that may not, it's not that you're going to take an antibiotic and you're then going to have diabetes or obesity. It's that you'll take an antibiotic and then you'll create changes in the bacterial flora of the intestinal tract that over the period of years can lead to obesity, can lead to cancer, can lead to diabetes, allergies, asthma. Most people on the planet have had antibiotics, so it's a very common, to me, a condition to be dealt with. Sort of the post-antibiotic syndrome that results from antibiotic use is something that impacts everybody's health. And in some of the research that's been done, definitely people who are hospitalized and who are given antibiotics tend to contract more infections and more what are called hospital-acquired infections than other patients who are never given antibiotics. But about 11 to 15% of the people who are never given antibiotics in a hospital setting will still acquire hospital infections of these antibiotic-resistant organisms. So it's something that's very problematic in our society. As far as statistics go, there are 99,000 deaths each year associated with hospital-acquired infections. So that means primarily antibiotic-resistant infections. There's another 144,000 emergency room visits that are due to antibiotics. Antibiotics kill people each year, just outright kill people, people who have an allergic reaction. And in preparing for this talk, I have so many research articles that I have bookmarked and that I've gathered over the years that it's very overwhelming to figure out what I'm going to talk about. But at the same time, it's also very easy to pick from such a wide variety of studies that show the negative effects of antibiotics. And what has really developed more recently in the past 5 to 10 years, let's say, is that the awareness of how antibiotics affect the bacterial flora is very significant. Most researchers, when they talk about the intestinal flora of the body, they say it is of primal importance, it's critical, it's vital to health, it's something that its influence on health cannot be denied. And when you take antibiotics, you're destroying this organ, really, and how it's viewed by many researchers these days, that all the 100 trillion bacteria that make up the intestinal tract versus the 10 trillion human cells in the body, the 100 trillion bacteria is very vital and important to health. So if we take antibiotics and we destroy this, as also chemotherapy will do, will destroy all the bacteria in the intestinal tract as well as healthy cells. But if we take antibiotics, we're destroying 100 trillion bacteria in the intestinal tract. Studies have been done that have shown that in one study with clindamycin that as long as 9 months later, there was no bacteria in the intestinal tract after taking antibiotics. 9 months later, there were no beneficial organisms. The only thing that was present were the bacteria that were antibiotic resistant. So we've created this antibiotic resistance, and the only ones that survive are the bacteria that develop the resistance. A common misconception over the years has been that antibiotics kill all the weak strains and only the strong strains survive. But recent research shows that that's not the case. It's actually the strong strains many times which will sacrifice themselves because they're able to take the antibiotics, develop the mechanisms inside the cells of the bacteria to counter the antibiotics, and then they pass that information on to the weak strains. So recent research shows us that it's actually the weak strains that are surviving quite effectively with antibiotics. And so that's something else to take note of, because with science, something's always coming along to sort of update us on what we think we know. And even in the field of science, the assumption that it was the weak strains that were dying off was just an assumption based on what one might consider to be a rational explanation of what was happening, but in reality, the stronger strains were the ones that were developing the resistant mechanisms for the weaker strains to survive. So it's not just that the bacteria that are strong are the ones that stay. Another important thing to note when we take antibiotics, that Sometimes, at least as far as we know from research, that the original makeup of the intestinal flora never regains its original state that existed prior to antibiotic use. And depending on which bacterial species you wipe out, that can have a strongly detrimental effect. Some studies show that Bacteroides, which is the most abundant anaerobic bacteria present in the intestinal tract, can be severely destroyed by certain antibiotics. Bacteroides play a role in producing short-chain fatty acids, and short-chain fatty acids play a protective role for the intestinal tract. They help prevent against leaky gut, chronic inflammation, colitis, Crohn's, irritable bowel disease, and cancer. So short-chain fatty acids can actually create the loss of short-chain fatty acids due to the loss of the Bacteroides species of bacteria, which is the most abundant species, can lead to cancers in the body. And again, that's not something that's going to happen right away. Although some of the more acute problems that do occur with antibiotics are going to be diarrhea and vomiting, occasionally life-threatening colitis. The inability to digest food is very common. You have antibiotics and all of a sudden you can't digest food. And this is one of the things when I'm talking with people as a way to gauge the health of their intestinal tract, I will ask them if they eat red meat. And if they do eat red meat, how long does it take them to digest that red meat? And what I mean by that, if you eat red meat, how long before you're hungry again? Because when people are doing the McCombs plan, we find that if they eat a steak and they have some potatoes and they have a bunch of vegetables, that within an hour they're hungry again. They want more. And that's the sign of a digestive tract which is very effective at digesting food and processing everything, all the nutrients. So it's important to understand that antibiotics are creating a very devastating effect, and with the loss of all these beneficial bacteria, we lose digestive function. And it's these bacteria which synthesize vitamin K for clotting. They synthesize B vitamins, which are necessary for use with everything in the body. B vitamins are essential in the ability to digest and absorb proteins, fats, and carbohydrates. That's everything. That's pretty much everything unless you're living on liquids and just water. Because if you have something which has carbohydrates like sugar or something like that, then that's carbohydrates. So B vitamins also play a very important role in helping to synthesize hydrochloric acid for the stomach. Without hydrochloric acid, we lose the absorption of protein or the amino acids. We lose the absorption of calcium, of iron, iodine for thyroid function, calcium for strong bones and for many reactions in the body. We lose magnesium with over 300 known functions in the body. If we start losing absorption of magnesium, that's very devastating. But you can see each one of these ingredients has a very widespread role in the body in terms of health and function. And if we start losing the ability to absorb these nutrients, B12, folic acid is known to protect against cancer. B12 deficiencies play a tremendous role in proper nervous system function. B12 and folic acid deficiencies also create different types of anemia, as well as does iron. But it's you're unlikely to see those deficiencies in a regular blood test because it takes a long time for iron to show up as deficient in a blood test when we've lost the ability to absorb it. You'll probably see some other markers such as ferritin and tissue iron binding capacity, other things, maybe hemoglobin, maybe you'll see decrease in red blood cell production. So there are a lot of other factors that can show up on a blood test when we lose the absorption of these nutrients. But the bottom line is when we take antibiotics and we destroy the gut flora, we start having a lot of downline effects from the use of antibiotics. So I know many people are concerned about whether or not if I didn't have an antibiotic, what would I take? Or also many people are misled to believe that antibiotics have no effect on the body. And we'll even tell you, I took antibiotics, I had a cold, I had fever, I had, my body was achy, I didn't feel well, and I took antibiotics and I felt better. If antibiotics didn't work, why did that happen? Well, you have to look at what antibiotics do in the body. Antibiotics suppress the immune system. Now, this right there, it has to be one of the big mysteries of life, that according to the germ theory, an infectious organism has gotten into the body, and the body can't defend itself against this organism, so it sets up a disease state or an infectious state in the body. So does it make sense then to take something which suppresses the immune system, which is what we normally associate with us being healthy and us having the ability to eliminate infectious organisms so we don't develop colds and flus and the types of diseases and conditions. It doesn't make sense at all, but yet that's what antibiotics do. They always suppress the immune system. If you look at the list of side effects for antibiotics, you'll see leukopenia, neutropenia. These are suppression of white blood cells. Especially neutropenia is the most effective. It's like the heavyweight when it comes to white blood cells at getting rid of viruses and fungus, such as Candida albicans and other infectious agents. And so we're suppressing the immune system every time we take an antibiotic. And well, how does that make us feel better? Well, when we have an infection or when we have exposure to chemicals and toxins, because you also have to realize that what we may interpret as an infection or as a cold is most likely going to be due to all the chemicals and toxins that we're exposed to on a daily basis, and less likely due to infectious agents. So what we have is we have white blood cells, which produce substances called cytokines, proteins, and these cytokines then cause the symptoms that are fever, achiness, joint aches and pains, the runny nose, that overall feeling of sickness in the body. So you see that's actually a healthy immune response. It's part of the pro-inflammatory immune response, which then sets in motion other series of events in the body which produce healing. So when we take an antibiotic, when we suppress the immune system, we're also suppressing that healing cascade or that progression of healing in the body, because these immune cells and cytokine and their function play a role in this. So I think I've just talked nonstop, probably longer than I've ever talked in my life. But we're going to take a caller on line 1, so let's see who's here. Hello, it's Dr. McCombs. Thanks for joining us.
Oh, yes, am I supposed to ask my question now?
Yes, you are.
Okay, I didn't know if you... Yes, I was very interested in the fungal form and what you said about it as far as that it was releasing enzymes. And so is it just kind of, when it's in that form, is it just destroying our bodies and tissues, kind of like mildew or something? I read in this lady's book, let's see, it's Allergies, Disease in Disguise. She said that it puts, tentacles or something inside our cells and sucks things out, and then it lowers the oxygen, drastically lowers the oxygen in the cell.
Yes, in terms of Candida albicans, it normally exists as a yeast organism, and it converts to the fungal form primarily due to many of the effects that antibiotics create in the body. And the fungal form is the yeast form is sort of like a little cell, and the fungal form is more like your hand. It has all these little extensions on it that grow out, sort of branch-like a tree. And many times, if you see a well-developed mass of fungus in the body, it looks much like tumbleweed. It's all these branches that interconnect. Even when the cell develops these little primary branches, these branches have the ability to pierce through the cell wall and destroy the cell wall membrane, which then gives them access to the nutrients inside of cells. They also do that with red blood cells, and they do that with red blood cells to specifically derive the iron out of red blood cells, because most organisms, or if not all organisms, need iron as one of the cofactors or nutrients that help them propagate and spread throughout the body. Will it lower the oxygen inside a cell? It'll lower many things inside the cell, and quite routinely just destroys the cell. If we look at the cells lining the intestinal tract, the yeast converts to the fungal form, and many people think that we have leaky gut because the yeast cells pierce through the intestinal wall and leave holes. Well, the intestinal cells themselves actually replace or turn over every 3 to 5 days, so there's a rapid turnover, and so there's a rapid repairing process in the intestinal cells. But leaky gut is actually, when cells come together, they join, and that place where they join, that juncture or that junction, is what separates to create leaky gut. What Candida does, opposite of that, it goes right through the cell. So it doesn't go through the junction, it goes through the cell because it's easier for it to go through the cell wall membrane. Chronic inflammation, however, and the presence of a lot of enzymes can cause separation of these junctions. So Candida albicans is known for producing a wide variety of enzymes, specifically one class called secreted aspartyl proteases. Secreted aspartyl proteases, as proteases do, destroy protein structures in the body. But it also secretes phospholipases, which are going to break down fats, and it secretes enzymes for sugar. So it has the ability to digest and dissolve a lot of different substances. And definitely the science is there and the research is there that shows that it causes sort of a blistering of tissue, where within several hours of having antibiotics, you could have some blistering of tissue of the liver or of the kidneys or other tissues. But definitely this has been demonstrated through studies that to occur with the liver and the kidneys, which are two favorite sites, it seems, for Candida to set up in the body. So the enzymes can be very detrimental, and enzymes seem to be one of the strongest virulence factors, one of the strongest factors that enables Candida to spread through the body. And these enzymes have the ability to digest a lot of substances in the body, which enables it to continue to spread and set up and to live within almost any environment in the body, even if it is consumed by a white blood cell, as we've demonstrated by putting out some videos that are on our website and on the Candida Library, candidalibrary.org. The videos demonstrate that white blood cells will consume Candida albicans in its yeast form, but it can't destroy it. But if you see another video, we have another video that shows white blood cells consuming bacteria, and it destroys it, just dissolves and disappears within a matter of seconds. It doesn't happen with Candida because it can adapt instantly to the internal environment of white blood cells. So it makes it a very, it's an amazing organism in its ability to adapt to almost or every environment in the body. It's amazing in its ability to adapt under many conditions. It's an organism which can change its genetics very quickly if it determines that something that is in its environment is going to kill it or destroy it. It can start to remove that part of itself which is susceptible to whatever is in the environment. I mean, that's an amazing ability for any organism, and Candida definitely has that ability. It also has the ability to shift back to its yeast organism when the conditions are present. So it can go back and forth at will depending on which state is most beneficial to its continued survival in any environment in the body. So I hope that answers your question.
Yes. Well, one thing, as far as it consuming the iron, I would notice, when people very often, when they become very, very, very ill with yeast, they'll just get like white as snow. They just have no color, in their face. I didn't know if that, yeast can make you very anemic then.
Yeah. I don't know, maybe we can call that the snowman syndrome.
Well, I would just notice, like when I first started observing my face in yeast, that then when I ate off, the yeast-free diet, I would, I would get real pale, but then my color, could come back, and so I didn't know. But I just observed it, change.
Yeah, definitely. That can be in part due to Candida, and I also really look at that as part of the post-antibiotic effect in the body, where by destroying the beneficial, or basically all the bacteria in the intestinal tract is beneficial when it's in a balanced state, whether it's pathogenic or non-pathogenic. But I see that by losing the bacteria, we lose the ability to produce hydrochloric acid, and then we lose absorption of iron, B12, and folic acid, and those three can create anemia. So you're more likely to see that anemic state in individuals, and that's very common. So, yeah, I can definitely relate to what you're saying.
Oh, I just had one more quick question. You said if you go, I went on Dr. Truss's program, and I felt the best. I mean, I was so sick. I only felt my best if I had to just eat something green and then meat. And but you said that it goes into its fungal state then, and I was just wondering, why would I feel that made me feel the best, just to eat meat? And I really couldn't even tolerate, a yellow vegetable. And so You know what I mean? If it was going into its fungal state, if I was just eating greens and meat, I didn't know.
Well, whenever we change our diet, we instantly change the composition or the makeup of the intestinal flora. It's a very instantaneous process. So if we go from a lot of processed foods to a whole food diet, which is very beneficial to us for many reasons, but by just doing that, we instantly change the makeup of the intestinal flora. The meat itself, definitely if we're protein deficient, protein drives the immune system. So without the ability to absorb protein or get enough protein in our body, the immune system is going to be weaker. All the enzymes are based in amino acids, the subsets of protein. So you need protein for all your enzymes, which make everything function in the body. Definitely, if we've lost the ability to digest certain foods, a more simplistic diet tends to be more effective and healing for many individuals. So we reduce the diet down to something that's more simplistic, that's easier for the body to handle. If we look at like rotation protocols where we rotate certain foods, or food combining protocols where we don't eat certain foods together, you'll see in those approaches we're sort of minimizing the foods we eat, and we're eating them in ways which are easier for the body to process. But what I find in people who are doing the McCombs plan is they eat steak and potato and vegetables, and in the food combination approach, you're not supposed to do that. But in the McCombs plan, they do it, they burn through it, an hour later they're hungry. So there wasn't an inability to process that combination. So sometimes I look at food combining as a way to manage digestive imbalance and not necessarily a way to correct it. But it's also a way to sort of lessen the stressors on the body in terms of digestion. Is that it?
Yeah, I guess so. I don't know. I could ask you questions all day long, but let somebody else.
Yeah, when I do book talks, that's what happens. We go in a bookstore, they tell me within 30 minutes everybody's going to be bored, so you better start wrapping up. And then these usually start at 7, and then at 10 o'clock they're kicking us out of the bookstore because it just goes on and on. People are interested in health, and there's a lot of information that I think people need to know, and they're really looking for that information.
Well, I think Dr. Truss had a waiting list 2 years long, I think, after he was, of course he's passed deceased now, but after he was on Oprah, or maybe it was just that magazine, no, it was a magazine article in Omni called Disease in Disguise, and it was about his research and trying to treat people with, he was a pioneer in it. And I think people just really relate to it because they just feel like that's their problem,
Yeah, well, definitely it has a wide encompassing set of symptoms when you have this problem, because it affects the intestinal flora, which affects everything else in the body. So the symptoms that one could experience after having used antibiotics includes every tissue of the body. And not only does it include the tissues, the cells, the organs, the systems, but it also includes the mental and emotional state. It's really, Dr. Truss's work was really more geared initially into the treatment of sort of the mental emotional realm of people who had more psychiatric disorders, and he found that by treating the gut, he was able to affect a change and affect a healthy and good response mentally, emotionally in people. So it has a widespread effect. It's not just the physical, and we see that. We see people who have done antibiotics and whose lives have been destroyed by antibiotics are emotionally and mentally affected to a severe degree. Especially the more severe the effect from having done antibiotics, the more likely it's going to affect us emotionally and mentally. But also when we start losing all the B vitamins, which again the beneficial bacteria of the intestinal tract produce, B vitamins are the nutrient for the brain. So you're losing that, you're going to have B vitamins that are linked to schizophrenia, depression, anxiety, brain fog. So just the loss of B vitamins and the ability to absorb, and then the loss of the enzymes and the loss of all these nutrients has a very strong detrimental effect on us physically, mentally, emotionally.
So, I have been so yeasty I would smell like bread baking on my scalp and my home. So that's a lot of acid. Isn't that acetaldehyde overload?
Possibly, yeah. Yeah, I mean the aldehyde is,
Like if you
implicated.
you smell like a bread baking machine, then you have a lot of yeast doing whatever it does.
Yeah, I mean the way I tend to look at that is in general we have an imbalance in the body, and
Uh-huh.
it's going to be an imbalance in the healthy bacterial flora, which would counteract that. It's going to be an imbalance in the pathogenic organisms that are present, which can be Candida, which can be E. coli and Klebsiella and staph, and so it's all these things. It's all these things together, which is when I work with people to correct the fungal condition of Candida in the body. It's really a whole body approach. It's not that I take Candida out of context and I only look at this. I look at everything else that we're doing, because that's the way you really create health, and that's the way you really create transformation in the body. Okay.
Is this webinar going to be in your Candida library?
Yes, it is. You're going to be famous, I'll tell you. For other people who
Well,
want...
I'm not getting it on my computer, and so I was hoping that I could watch it. It's a computer problem with my computer, the flash.
Yeah, well, we can definitely relate because we were late in getting started today because we were having problems with our computer. But it'll be in the Candida library. It'll be on our website also, so you can replay it and get the information there again.
So I just had one more question, and I won't ask anymore, but something you brought up that made me realize, I always wondered if you could have Candida affecting you but still be healthy, because like I said, I have this beauty book that I've been working on for a long time. Like, I think just by looking at, Oprah's face, that she's very yeasty. I mean, I can just look at people's faces, if they're kind of puffy or if they're overly saggy, because the yeast destroys collagen and acetaldehyde is, I don't know.
Yeah.
But I mean, so can you be a healthy or seemingly healthy and energetic and still be having yeast, too much yeast in your body, but you just haven't gotten sick?
Yeah, absolutely. The one study that comes to mind is a hospital-based study where they found that 85% of the people who had Candida had no symptoms of it whatsoever, or nothing that they would commonly identify as Candida. Okay. Thank you for calling. So for others who want to call, I keep flashing numbers in front of me here. So it's 888-236-7780. That's 888-236-7780. And they tell me that we have quite a few people tuned in, which is great. So I'm going to get back to antibiotics. I just have all these, what I decided to do, actually, because there was so much information, was just throw a bunch of pile of papers in front of me and try to address things as I had time. Again, when we talk about, I just had to pause there. They told me I had 15 minutes left, and I'm like, I thought we just 10 minutes into this. Have I been talking that long? If we look at the problem of antibiotic use, there are organisms on the planet now which are immune to all antibiotics. For many years, we had a classification of antibiotics called MDR, which was multi-drug resistant bacteria. So they were resistant to 2 or 3 antibiotics. And then that developed into extensively drug resistant. And that meant they were resistant to 4, 5, 6, 7 antibiotics. And now, within the past couple of years, we have a new classification, which is called PDR, I believe, pan-drug resistant, which means they're immune to all antibiotics. So there are no antibiotics left that can treat these infectious agents. The 2 that come to mind are tuberculosis, which is very common, very problematic, especially in New York City and in the United States. High rate of tuberculosis. Many people carry it and they're not aware of it. NDM1 is a new strain out of India, New Delhi, India, and that has made its way to Britain and Australia and now the United States. So these strains are just spreading, and this is one of the paradoxes of antibiotic use. The use of antibiotics is such that eventually you cannot use antibiotics because the environmental pressure from the use of antibiotics outdates antibiotics. So if I use antibiotics, that means eventually I won't ever be able to use antibiotics. It's just that simple. You cannot, it kind of selects itself to eliminate because of these sort of natural pressures or these natural effects that take place. So if I use an antibiotic, I instantly create antibiotic-resistant strains. And the more I use antibiotics, the more resistance we see. And that's what we're seeing in the world, which is why antibiotics are one of the three top threats to human health. So we have another caller on line 2. Hello, it's Dr. McCombs. Go ahead. Yes.
Dr. McCombs, I have a question.
Yes.
I'm going to turn you down so I don't hear.
Okay, and
I'm getting an echo delayed. Okay.
but make sure you speak loudly because I'm not hearing you very well.
All right. I have a question about dairy. I'm wondering about the effects of dairy products and not just the sugars in the dairy, but if you're eating the cheeses and yogurts and things, are these detrimental or helpful for the body, and in what ways?
Well, I mean, just as a general practice, once you balance the intestinal flora, I'm not a big fan or proponent of pasteurized dairy. Pasteurization process changes the proteins and the sugars and the fats. It really destroys them, and it makes them something that's really not something you would consider a food. If we're talking, I'm a big proponent of raw dairy. It contains the enzymes it needs to help process and digest the dairy. It has a natural bacterial flora within it, which kills E. coli or anything else that might harm us. And they've done tests where they take E. coli and drop it in raw dairy. Because of this living culture within it, it completely destroys the E. coli. And you take the same E. coli and you drop it in pasteurized dairy, and you've got a very toxic food product because there's nothing in the pasteurized dairy to stop the E. coli from multiplying and becoming problematic if we were to consume that product. So, I mean, dairy itself is very good. Yogurts, I kind of more stand on the side of using kefir as opposed to yogurt unless it's homemade yogurt. Kefir tends to have much more bioactive cultures, bacteria within it. There's some criticism of yogurts that by the time we buy them off the shelf at the store, that most of the bacteria in there is dead. So it's, I like kefir for that reason much better. It tends to be much more active, and I mean, definitely you can feel that effect if you have kefir versus if you have yogurt. The kefir can feel much more active, and it's like it's doing something in your body, like it's a very life-giving substance. Did you have another question? Hello? Maybe not. Okay. So the human intestinal tract has been called the densest ecosystem on the planet, and many times we can't really tell much about what's in there because we don't have the ability, the means to identify all the bacterial species that are in the intestinal tract. Depending on the source, there's some 400 to 500 different species that make up the 100 trillion microorganisms or bacteria in the intestinal tract. But some studies now are suggesting that there are 6,000 species and even 40,000 species. And when you look at probiotics, you're really looking at a very limited range of bacterial species that we're able to culture separate from the intestinal tract. Most bacterial species we can't culture, so that's why we're starting to see more news about the use of a form of therapy called bacterial therapy or fecal transplants, where we take the feces from one person and minimally process it, and then using an enema process we'll insert it into another person, and we're seeing tremendous cure rates for diseases that are infectious agents like Clostridium difficile. Now, Clostridium difficile, as I mentioned earlier, just passed MRSA as the #1 infectious agent in the United States, and that was late last year. So what they find that with bacterial therapy, the cure rate is as high as 90%. Now, there's nothing else out there to produce that cure rate. And if you use antibiotics, you just create more of the same problem. In fact, some studies show that what we previously believed, that if you use one antibiotic and then another and another, that we were creating a cumulative effect in the ability to eradicate bacteria. And the thought is that we're just getting the bad stuff, but we're getting all the bacteria, as the science shows us. But what the recent research shows us is when you've had one antibiotic, and you develop bacterial resistance to that antibiotic fairly quickly, and you take another antibiotic, that we have now shortened the time with which the resistance develops. Now, if we take another antibiotic, the resistance develops even faster. So the more antibiotics we get, the more we see this resistance develop very quickly. So it's, again, we're learning more and more, and basically no one has been asking these questions for a long time, and it's only recently that we've started to ask these type of questions about antibiotics, and we've seen from the research and from studies and implications over decades that antibiotics are very detrimental and antibiotics create problems. Alexander Fleming, who is credited with the discovery of penicillin, which technically most people assume also is the discovery of antibiotics, although it did precede him. And he did share in the Nobel Prize with the two other researchers who had discovered antibiotics prior to him, that antibiotic resistance develops very quickly. So even back then, with the cruder conditions that were available to them to discover this, it was very obvious that antibiotic resistance developed very quickly. So typically, the medical profession denies that this happens, and they blame patients for antibiotic resistance primarily. I saw a study yesterday where the experts were blaming the general practitioners for antibiotic resistance, stating that general practitioners prescribe over 90% of the antibiotics, and 50 to 70 to 80% of the time they're unnecessary. But the GPs, the general practitioners, the general medical doctors, blame the patients and say, well, the patient only has antibiotic resistant strains because they didn't take the complete dosage. They didn't take the 7-day dosage. They didn't take the 10-day dosage of the antibiotics I prescribed. They stopped somewhere along the way. And many people will stop with all the diarrhea and the vomiting and how bad they feel with the antibiotic, but that doesn't create antibiotic resistance. Antibiotic resistance is due to exposing bacteria to antibiotics. It's not how long you expose it, which has already been proven. It's just by the mere effect of exposing bacteria to antibiotics that you get antibiotic resistance. So we're discovering more and more. We're learning more and more. And as I said, the evidence is overwhelming. I could definitely go on and talk about this. When we talk about the changes, the science tends to refer to it as dramatic changes in the intestinal flora. It's saying it's destroying a mutualistic relationship between the bacteria and the host. There was a great study that was released just a couple months ago by Albert Einstein Medical College, and what their point was that that pathogenic bacteria are not the problem. It is only when the host, which is us, the human, or any animal really, when their immune system is weakened, that the pathogenic bacteria become a problem. Because the pathogenic bacteria are always there, alongside the other, what we call beneficial bacteria, or commensal bacteria in the intestinal tract. I have twins. When my twins were born, they came 25 weeks early, so I got to spend 5 months at the neonatal intensive care unit and got to see quite a bit of this. But most of the kids who come out of these NICUs, or anybody who really has surgery, comes out of any hospital where they have had antibiotics in their stay, has many different types of antibiotic-resistant strains. And as I spoke of earlier, even people who weren't given antibiotics in the hospital, 11 to 15% of those people left the hospital with an antibiotic-resistant or pathogenic bacteria. So the ones who were given it, the rate of transmission of antibiotic-resistant strains was extremely high. And they take that out into the community, and just as the hospital setting demonstrated, that people who aren't even being given antibiotics in the presence of these bacteria will get those get transferred into their body from being around people who have all these antibiotic resistant strains. So it can pretty much be assumed that most of us have pathogenic bacteria, even if we haven't had antibiotics. So it's very important to understand that it's not just if you take antibiotics that you'll have pathogenic bacteria. And that's problematic in that should your immune system be weakened along the way, you're more likely to have some type of effect from that. But again, I believe that most immune system weakness comes from the chemicals in the environment. There are over 140,000 chemicals in the environment. Babies are being born pre-polluted with over 200 chemicals. In testing for I think 416 chemicals, The average was 200 in each baby, and when I went to school, that was impossible. That never happened, according to what we knew and what we understood at the time. That was 1984. So we're learning more, but really what we're learning is that antibiotics have a cost. They have a long-term effect. The field of epigenetics, which is the study of how outside things influence our genetics, which means chemicals and heavy metals and medications, as well as the foods and the herbs and the supplements, how these all have an effect. We know that some of these effects some of these negative effects are going to, and even the beneficial ones, will be transferred many generations. So that if you're exposed to chemicals, you're going to, the chemicals that you're exposed to in this lifetime, if you have babies after that exposure, are going to be transmitted to your great-grandchildren. And there are already going to be some disadvantaged to some extent from the chemicals you were exposed to, and that your children and that your grandchildren, who would be their parents, were exposed to. So there's this very cumulative effect in the body. So medications are not, I don't think medications are the answer. I think we have time for one more call, in case anybody's sitting on the sidelines waiting to call in. Again, the number is 888-236-7780. What do I want to talk about? Oh, I don't really want to make this all doom and gloom about antibiotics and we're doomed, but it can definitely seem that way. And I spend a lot of time in research, and so I have to keep a healthy, optimistic perspective. And it's easy to do because I've lived a life around nutrients and vitamins and whole foods, and I know the benefit of those. And more that's very evident in what the research shows us. We show that we can reverse cardiovascular disease and cancer. In the field of epigenetics, it's being demonstrated that almost every condition is reversible. So, and that's primarily through whole foods and fruits and vegetables and herbs. So there are a lot of choices for us. If we look at some of the natural choices as opposed to use antibiotics, of course, there's some of the well-known ones are going to be garlic and oregano, and I'm sort of looking for my list here, and probiotics and thyme and rosemary, a lot of these herbs that we can cook with on a daily basis. Tea tree oil, grapefruit seed extract. There's a great product for anybody who has ear infections or their children. If you have children, you have to have Nutribiotic eardrops because they have tea tree oil and grapefruit seed extract, and they knock out infections of the ear very quickly. But keeping in mind what we've learned about the host bacterial relationship or microbiotic relationship, it's the health of the host is very important. So taking things that boost your immune system like Immunocal, Immunopro, glutathione, N-acetylcysteine, organic foods, fruits, vegetables, these are things that work for us. Drinking plenty of water, getting plenty of rest, exercise. What are more antibiotic choices? Frankincense and myrrh. I mean, this is something that goes back to, thousands of years, to biblical days when these were being used. If you have a cut, lime juice has been proven to be 100% effective against organisms that might set up an infection. And it's going to sting a little bit, but that's part of its effectiveness, but it doesn't create antibacterial resistant strains that are going to be problematic for you then. So if you use lime juice for cuts, honey is, I think, one of the most incredible products out there for healing cuts and for healing skin conditions. It has so many antibacterial, antiviral properties. It's been proven to be effective against antibiotic-resistant strains, proven to be effective against MRSA. So, I mean, we have a lot of natural choices. There was a study I looked at yesterday in preparing for this where there were 2,600 plants that were used by Native American Indians to treat infections and diseases, 2,600. We're definitely not at a loss for all the choices we have. We have many choices which would, I think, be primary in echinacea, vitamin C, golden seal, mushroom extracts. I mean, these are all powerful immune system stimulators and things which have definitely proven to be effective against diseases. And I've read where echinacea was actually used quite a bit prior to the introduction of antibiotics, even by MDs. When antibiotics were first being prescribed, you always were prescribed probiotics at the same time to replace what was being killed. So probiotics are very important. The bacteria produce their own antibacterial, antifungal enzymes. So there are a lot of natural products out there, and definitely detoxifying the body frequently is another way to stay ahead of living in today's world. So we're going to take another caller. Hold with us. Hello, this is Dr. McCombs. Hello? So we'll come back to them. Let me know if they're still there. Sometimes because I talk so long, people think people are listening to me and they forget that they're calling in too. So again, with the natural products, you know, I've seen great effects with Immunical and Immunopro. I've seen great effects in people who have had cancer from those products. So it's very important to understand that there is a wealth of there are a wealth of products out there that we can use, and that we don't have to think that only antibiotics have the solution. And again, antibiotics are just creating a problem, and antibiotics will definitely create long-term problems if you're in your body. Even if you had them 10, 20, 30, 40, 50 years ago, you permanently altered the makeup of your bacterial flora, and that needs to be reset. You need to do a reset. The McCombs plan is really, that's in many ways what it's about, is to reverse the effects of antibiotics. Okay, we're going to go to the phone again. Hopefully this works. Hello, this is Dr. McCombs. It's not working. Yeah. So it's, you know, I think we have a lot of choices. I think, I mean, I can definitely go on. Well, I think when we post this video, we'll also post a lot of the references that I've cited here. I'll go through the material and I'll post that. They're telling me we have callers on these lines, but every time I pick up the phone, nobody's there. I'll try again. Hello, this is Dr. McCombs. Let me get this. Hello, this is Dr. McCombs. Hello? Okay. So again, a little bit more of the, I think we're having problems with our technology now with phone systems here. I'll try it one more time. Hello, it's Dr. McCombs. Hello?
Hi.
Ah, we figured it out. Okay. Sorry about that. Not as long as Hugo sits here and holds the phone.
I have a question for you about hives and Candida. Can you tell me about any correlation between the two? And because I'm aware that I get hives, and there seems to be no reason, but I'm just getting started with the Candida cleanse, thinking that maybe there's relationship between the two.
Yeah, well, hives are definitely seen as an allergic reaction to something that you're either consuming or something that you've been exposed to, and is very active in the body. Definitely all skin conditions can be related to a deficiency of hydrochloric acid in the stomach, which then goes back to upsetting the balance of the intestinal flora. Candida produces enzymes, it produces byproducts that cause tissue destruction. This can also play a role. If you have an active infection, or again, if we go back to this sort of the big elephant in the room that nobody talks about, the 140,000 chemicals in the environment, these accumulate in the body. They definitely accumulate in the fatty layer of the skin. And if we have increased levels of inflammation in the body due to the intestinal flora being imbalanced, and due to the presence of Candida and the way it upregulates inflammation in the body, that can play a role. Many times Candida creates problems, or it maintains problems, or it contributes to problems. So it can be any or all of those in terms of Candida. But again, it goes back to this imbalanced intestinal flora, the imbalance in the flora on the surface of the skin, and the inflammation and the inflammatory reaction that your body's having. So hives tend to be somewhere in the mix of all this, and it can be related. Candida will definitely be a post-antibiotic syndrome problem, and hives are listed as one of the side effects from antibiotics. And I think many times we look at things in such a narrow perspective, but you could have taken antibiotics 10 years ago, and you may be having a reaction to antibiotic residues that are in the body now that may be released for some reason, that may be part of a detoxification process, or because of other additional exposures to other chemicals. Together they're producing an effect, but it could in part be due to antibiotic use from the past. It doesn't have to be now, it doesn't have to be recent. The fact that antibiotics are a side effect of antibiotic, hives are a side effect of antibiotic use, doesn't mean that it has to be immediate. It could be years down the road.
So is there value then doing something topically in addition to the diet?
It depends on the hives. If there's an opening, if there's some pus that's being discharged, sometimes I think honey is really effective. It seals it. It's antibacterial, antimicrobial. Using, if you're taking baths or something, putting some pteramine clay or some type of clay, Epsom salts or magnesium flakes, tea tree oil, milk. You can add milk. You can add apple cider vinegar. Many times when we have skin problems, it's because we've lost the fatty layer, which maintains the acid layer underneath, and the acid layer maintains the right bacteria that need to be present there through the effect of the pH of the acidity. So when we use soaps and shampoos, these things destroy the fatty layer, and then that causes loss of the acid layer. So we can use milk in a bath. We can use apple cider vinegar, which is slightly acidic, in a bath. You can use antimicrobials like tea tree oil or even honey in baths. So I was just reading a post a couple days ago about some of the ancient baths where they used milk and honey in baths, and that's very beneficial to the skin sometimes. Again, I'd probably use raw milk and raw unheated honey, but people are having benefits from just regular store-bought milk.
Terrific. Okay, thank you so much.
You're welcome.
Appreciate it. Bye-bye.
You're welcome. Okay, now I think we can go to line 2. Hello, this is Dr. McCombs. Hello? Okay. Yeah. Every time I go to line 2, nobody's there, so I don't know what to say. Sorry. Maybe if they call back again on another line, they'll be able to get through. That would be a good idea. Again, a lot of this information the video will be replayed. It will be on our website, candidaplan.com. Many people, we've been McCombs Plan for a while, and we actually decided to be a little bit more targeted in how we market ourselves. So our new web address is candidaplan.com. If you go to McCombsplan.com, it'll simply forward to candidaplan.com. Again, there's the candidalibrary.org, where we have hundreds of studies that we posted there, and we're always posting more. And it looks like we have another caller, so we'll go there. Hello, it's Dr. McCombs. Yes.
Okay, it's my turn. Okay. I was interested. I just feel like it really affects your nerves, because when I was real sick with it, if I would eat off the yeast-free diet, my face would just really drop, and I was only like 32, and just like myasthenia gravis almost. But then when I would take the nystatin, then my face would go back up. It was like an elevator face. So I was just wondering, how it was affecting the nerve synapses or something in my face, because I had really bad, deep sinus infections before.
I'm glad you asked that. Blood sugar imbalances are very common with Candida. Candida has been shown through the effect of these enzymes that it produces to cause diabetes, as well as hypertension and immunosuppression. So definitely blood sugar imbalances cause hormonal imbalances, which also then can cause neurological problems. Another thing to consider when you look at something like myasthenia gravis or any autoimmune disease, Candida has been shown to cause arthritis and psoriasis and autoimmune conditions. Myasthenia gravis is something which can affect thyroid function, and most thyroid problems are autoimmune, and most autoimmune comes again from the digestive tract, and most digestive tract problems come from antibiotic use. So you can definitely have an impact on the immune system, on blood sugar, on the hormonal system, on every system and tissue of the body through the presence of Candida. And it's something which has been shown to cause cancer, has been shown to cause neurological diseases, eye conditions, skin conditions, heart conditions, lung conditions, urinary tract conditions, liver conditions. So it affects prostatitis is another common thing. So it's not just that we lose digestive function, you can start having a lot of other systems affected by the presence of Candida. And it's going to be hard to always track it down, but what the science shows is that the effect is very pervasive in the body, and it can be very long term. So it has to be addressed if you've ever had antibiotics, and it needs to be addressed if you're really looking at getting healthy at some point in your path towards health. Is that it?
Thank you.
Okay, thank you for calling. One of the things that occurred to me with that question is we just recently published, put up on the website a bunch of different Candida tests that you can order through the website now. The ones that I consider to be the most sensitive is through Metamatrix, and that uses PCR genetic testing. Diagnostics also does a nice panel. It's like the Metamatrix. It's a stool panel, but Diagnostics also does salivary testing with it. Great Plains Labs does organic acid testing. That's urinary testing, so that's another way. And whenever you're testing for Candida, and I personally believe if you've done antibiotics, that's proof enough of having a systemic fungal Candida infection, because anytime a researcher wants to study Candida, he uses antibiotics to create that fungal effect, that pathogenic effect. We also have blood tests, a Candida immune complex and Candida antibodies. The antibody tends to be the least sensitive. The PCR stool test through Metamatrix tends to be the most sensitive. So we do offer those. And if you're looking to go that route, when you get a test, that also includes consultation with me for that. We have another caller on line 2. Hello, this is Dr. McCombs.
Hello?
Yes, hello.
Yeah, this is Allison Hasselquist,
Hi.
and I messaged you on Facebook before, and you said something about HCl levels. Can you describe some more of them and what you would do to up them?
Yeah, hydrochloric acid, or HCl, is the acid present in the stomach. And most people are aware of acid reflux and even a later descriptive called GERD, which for many decades, the way that's been treated, even though it's described as a condition of excess acid, it's always been treated as a deficiency of acid, which then results in cycles of over and underproduction. The overproduction cycles, which many times happens with eating a meal, is so much greater than it normally would be if the acid level was higher normally, that it creates the symptoms of the acid reflux. So people take acid reflux medications. The problem with this is that they suppress the already low acid level even lower, which when you go through these cycles of over and underproduction, that you get even higher cycles of overproduction. But in the process, you lose the absorption of protein, calcium, iron, iodine, B12, folic acid, magnesium, zinc, and other minerals by suppressing this. And that's you only I mean, this is known. This is going to be effect. This is just basic physiology. When you suppress hydrochloric acid levels, you're going to lose this, and you're also going to lose protection of the intestinal tract, and you're going to alter liver gallbladder function and pancreatic function, and you're going to alter the pH of the intestinal tract, which will alter the composition of the bacterial flora. So all this happens when the HCl is off, and you only recently will see black box warnings on proton pump inhibitors and these medications which suppress the hydrochloric acid. On the black box warning they're now putting on is that it can cause osteoporosis because you lose absorption of calcium. So long-term use is going to cause osteoporosis, causes a disease. And it's so interesting that only medications in the world are able to say that they treat, prevent, or cure disease, when in fact they promote a lot of disease in the body. they promote a great deal of disease. It's almost with every medication you can look up and you're going to see causes tuberculosis, causes osteoporosis, there's all these list of diseases that medications cause. So HCl, the traditional way to treat this is to give hydrochloric acid capsules. A more kind of natural home-based approach is to use apple cider vinegar, which is a weak acid. So again, we're adding acid, and that is what seems to work. By adding acid, we don't have these over and under production cycles. And in some people, if they have had this problem and it's very severe, and they've been taking the proton pump inhibitors and the medication to suppress the acid, it can take a long time to reset that. But definitely doing the plan to increase the production, increase the balance of the ecosystem of the intestinal tract and the bacterial flora, increases naturally the production and all the feedback mechanisms that are necessary to produce hydrochloric acid in the stomach. So
then when these levels are up, are they easier to kill the Candida? Is it easier to kill?
It's easier to, well, it's an important distinguishing point in our approach. Our approach is not to kill Candida, it's to correct it from its fungal form to its yeast form, because we're always trying to maintain the balance in this ecosystem, not create another imbalance. So the hydrochloric acid, yes, when in an acid state, that is a trigger that causes the conversion of Candida from its fungal form back to the yeast form. So the digestive tract is typically acidic, slightly acidic all the time, and when it develops more of an alkaline state, which interferes with function of enzymes and the composition of the bacterial flora and the function of the flora and the function of the immune system, then you get the conversion. That'll be one of the triggers. In more of an alkaline state, Candida converts from its yeast form to its fungal form. In an acid state, it converts back. So improving the acid level of the stomach does have an effect on the pH of the intestinal tract and does have an effect on Candida.
Okay. And pH balance is important in this too, right?
Yeah. I'm more of a proponent of self-regulation of the body to determine that. Most people who look at alkalinity and the whole pH issue try to make everything alkaline, which is not how it is in the body. The vaginal tissue is also very acidic. So there are tissues which are supposed to be acidic. There are tissues which are supposed to be alkaline. There are tissues which are supposed to be acidic at certain points. There are acids there are enzymes which are only functional at certain pHs. So if you change the pH, that you lose the function of that enzyme. So to make the body self-regulating is the goal. And that goes back to, I think, that definition of life, self-sustaining, self-regulating. So that's what we're looking to do, is to create that foundation of life again in the body.
Okay. Thank you.
You're welcome. Okay, they put a paper in front of me that says CandidaFactSheet.com. Candida Fact, F-A-C-T, sheet, S-H-E-E-T.com. CandidaFactSheet.com. This is a great little accumulation of a lot of important data that I feel is kind of a good way to educate yourself quickly about Candida. It addresses the antibiotic issue. It addresses many of the effects of Candida in the body. And it also is a great way to educate your doctor. I have included all the research abstracts with this fact sheet. I think there's about 79 of them. So as I list any of these effects that if, for instance, the medical profession only views Candida as occurring in immunosuppressed individuals. So these would be people that are on immunosuppressive medications, such as antibiotics, but they don't recognize that. Or they have HIV/AIDS patients, or there's something else, some type of autoimmune disease which is suppressing the immune system. So that's the only time they consider that Candida can be systemic. But if you look at the research, it shows that if you're malnourished, you can have Candida. If you had surgery, you can have Candida. If you're elderly, you can have Candida. If you're a young child, you can have Candida. And according to some of the research experts who spend their whole lives researching Candida, you don't have to have any of these and you can have systemic fungal Candida. According to one pharmaceutical company, same thing. You don't have to have any of these preconditions in order to have Candida. So I also include the abstracts that cite the research where this information comes from, and the research that shows that antibiotics create fungal candida, and several other important pieces of information to consider when we look at candida and the body as a whole are on the Candida fact sheet. It's a great great reference, and definitely you can educate yourself. I don't know if we can ever educate MDs, hopefully, but we'll see. So I think that's it. I think we're going to wrap up. Definitely, we hope to hear from you. We have a Facebook support group, our Candida support group on Facebook. We have our blogs everywhere. I blog on Pure Zone. I have a column I post on that frequently. We have our WordPress blog. We're working to get our main website so that anytime I blog, all that information will be on that website, and then disseminate it to all these other websites. I just started blogging on Insider Health and Natural Cures, and so I'm many places around, and you can find the information as I discover it and as I read about it. I put it out, and we get it out there. You can visit candidalibrary.org, our website, for hundreds of articles that reference Candida. You can give us a call, 888-236-7780, if you have questions. One of the things I think that we do in excellence, and we do that nobody else does, is the type of support that we provide for people as they're doing our plan, I think is phenomenal. We have hundreds of testimonials to this fact. You'll get Hugo, Lisa, Blanca, Virginia. I mean, you get people who have done the plan or doing the plan, who know a lot about the ins and outs of healthcare. They've definitely been listening to me. I'm glad somebody listens to me. But they know a lot, so they're good references even when you don't get me. And of course, I'm always available. We're here Monday through Friday, 9 to 5. I'm answering emails at night. I'm answering emails on the weekends sometimes. So you're never that far out away from us being able to assist you and help you. And we definitely encourage you to use that service and to really lean on us heavily if you need to. And we're here to support you. Thank you for tuning in, and we'll be doing more webcasts and more seminars along the way, and hope you tune back in and join us again. Thanks.
And we're out.
How do you stop broadcasting? How do you stop?